Hi, this is Doug Sutton, Chief Strategy Officer with Hypervibe, and today we've got an expert physiotherapist all the way from Perth, Australia, Dr. Glenn Ruscoe, and he's been in practice about 30 years, and it's just an honor to have him on here today because he's someone who's been working with whole body vibration for a number of years, and what we would consider as one of the experts in the world with the use of whole body vibration for physiotherapy in a multitude of different health conditions. So with that, I just would love to acknowledge you, Glenn, for being here today, and really appreciate that. And if you don't mind, just share a little bit about your background and how many years you've been in practice, a little bit about your practice, and we'll go from there.
All right, great. Thanks, Doug. My title is Specialist Musculoskeletal Physiotherapist, and I have been in practice, as you said, for about 29 years in the private sector, primarily. Started with some friends with a practice and gradually took over ownership and then brought in some partnership and grew our practice from a single physiotherapist up to about 20 staff.
Wow.
We have an orthopedic type bias, back pain, neck pain, but also a strong interest in women's health. And we have a very large Pilates-based rehabilitation gymnasium that we use, and it was through our gymnasium, our interest in exercise, that we first became aware of whole body vibration.
Wow. So how many years ago was that when you first heard about whole body vibration?
Yeah, it was in 2004, so some time ago. My business partner attended the World Conference on Low Back Pain, and she came across whole body vibration and returned to the practice to talk to me to say, this thing is amazing. And like most new initiatives, I took it fairly skeptically, but she persisted and presented the research that was being done, put it in front of me and said, look, if this thing does half of what the research is showing, it's going to make a huge difference. And that certainly got me interested.
Wow, that's amazing. So when you first became aware of it to the time that you actually decided to put it into your practice, what diligence process did you do, and how did you decide on Hypervibe?
Yeah, look, very good question. When we first looked at it, I looked at the research, and the research was mainly being conducted on a machine coming out of Germany. And so we pursued the manufacturer of that machine, and we saw the price, and that made us take a double take. Couldn't quite do it. So part of my role, my diligence role, was to check for alternatives. Mm-hmm. And really, at that time, the only alternatives on the market were lineal machines or vertical machines, as opposed to this tilting machine upon which most of the work was being done. And we had a look at these lineal machines, and their prices were probably about a quarter. And as the person in charge of the finances for the practice, I was into that option. But my partner was insistent that if the research was being produced on this German machine, then we need to go that way. So we did. We invested the money in it and had some great results. The outcomes were so fabulous that many of our clients said, look, I want one of these machines for home. How can I get one? But when we told them the price, again, they balked. It just wasn't possible. So that prompted me to go looking again for specifically tilting or pivotal plate alternatives. And around that time, Hypervibe had just started. So we made contact with the owner, Murray, and said, Murray, look, we love the concept. We love your price. Can we have a look at your product? And Murray brought his product into us, and we were amazed. It was this much difference between Murray's product and this high quality German one, and he was seeing it at a quarter of the price. And so we were very happy to recommend Hypervibe to our patients to utilize Hypervibe. And we just think it's the best value exercise product that you can get.
Yeah, well, I appreciate you sharing that. There's a couple different factors that were involved with Murray's decision-making process. Making it affordable, not just for medical professionals, but also for the patients that would therefore want to have it. And the research behind that German-made machine is definitely one of the ones and the reasons why Murray decided to design the Hypervibe the way that it was. So from your experience, what was the main reason or things that stood out? Because there is some confusion because there are a number of different platforms out there on the market. of why the pivotal platform was more important than the linear or some of the other types of planes of motion that there are out there.
Yeah, look, at first glance, that's where the evidence is coming from. So you use the machine that matches the evidence. But then from our own experience, we found that the pivotal machine offers a better outcome, better results. So first up, the tilting motion, the left-right of the pivotal plate matches the walking motion of human gait. And we found that more attractive. The second thing is the tilting motion, it moves you through the pelvis. So the vibrations traveling up to the head were significantly less. Mm-hmm. Then there were a few limitations on the vertical or lineal machines. The amplitude range that we could see was 2 or 4 millimeters. The pivotal machines, because the amplitude is relative to the width of your feet, meant you had a range of 1 millimeter up to 13 millimeters. And so that amplitude range offered us far more variety and variability of the dosage that we were applying to patients when using amplitude. And probably the final factor is that the frequency that was being produced. Because the amplitude is so small, to generate sufficient G-forces, the lineal or vertical plates need to have very high amplitudes. So they were 30 to 50 hertz. And that range is excessive, whereas we found the pivotal plates with with a frequency range of 1 to about 30 hertz, again, were offering us more variety, more options.
Yeah, that makes a lot of sense, and it's clear that you've done your research with it. So I'm impressed to hear that, because a lot of people, there is a lot of confusion out there in the market. So I really appreciate you sharing that. So
yeah, look, once we sort of captured the concepts, mm-hmm. It was blindly obvious that the pivotal machines produce better outcomes and offer us more flexibility.
Right, absolutely. And there's a lot of value also with some of those lower frequencies, where such as balance and other things like that, and even just being able to stretch that sometimes the higher frequencies based upon the research isn't able to achieve.
Yes, look, everyone thinks about the muscle strengthening component or functionality of the machines, but with lower frequencies, you can work on balance, you can work on other elements, and you want, when you have a gym, you want to have the least number of machines that offer the greatest range of services. Otherwise, you get a very crowded gym.
Yeah, absolutely. Well, appreciate that. So I'm curious to look at actual uses of how you've utilized Hypervibe in your practice. What are some of the top conditions that you've used it for with your patients, or that that you're actually seeing great results from?
Yeah, look. The first interest we had was building muscle strength quickly. So post-orthopedic surgery, total knee replacements, fractures, anyone who'd lost muscle bulk and were looking to build it quickly. What appealed to us most, the things that appealed to us most about whole body vibration was that it was incredibly effective and efficient, but most importantly, it was incredibly functional. So we could put the person on the machine in standing, and standing is where we spend most of our lives when we move, when we're not sitting down. And so it replicated that position, that functional position for the patient, and then we could exercise them in that position. So that was so muscle strength was an obvious one. A lot of the muscle strength comes from neural potentiation, which is the stimulation that machine causes into the nervous system to kind of wake up the nervous system to fire the muscles more. And we would often use it on our clients getting them to use other weight-based machines.
Yes.
So it would wake them up, wake up their bodies. They'd get better outcomes from their machines. Some of the highlights we had, look, I'll never forget this gentleman that we put on it whose loss of muscle mass was primarily just related to age, and it was becoming having an impact on his independence. And after 5 sessions on this machine, he delightedly reported to me that he could now put his trousers on standing up. Whereas previously he'd had to sit on the bed to get dressed. And just the independence that created because he had the strength to put his pants on standing up. It was particularly exciting. Some other areas. Very excited about bone strength. Two areas there. We had a couple of very interesting patients with delayed union, non-union fractures that, through stimulating the muscle through increased gravitational effects, really solved some of those problems. And then there's the osteoporotic osteopenia population that we were able to use the machine on as well. We used a number of athletes. We had a number of young athletes, would you believe, who are looking to build strength quickly, and particularly those involving jumping sports. Because of the strength and the power that it generates quickly, they are able to improve their vertical leap by 15-20%. And for a young athlete who was trying to break into the state volleyball team, the state basketball team, that was a huge bonus. I can never forget, we had a series of Irish dancers. I don't know if you're Irish dancing, where they put their hands down by the sides and they're jumping up and down, and they would be practicing their techniques on the machine to actually replicate the jumping.
Wow, that's amazing. Well, speaking into the strength training, we actually were able to get into Google corporate headquarters for their corporate wellness. And when I went up there, we told they have a personal trainer, and they have a fully functional health club on site on their campus at the Google headquarters. And we told the trainer not to open the machine and take it out of the box until we got there. And he admitted to us he did. And he used the Hypervibe, and immediately afterwards he shared this to me, that he did his all-time PR on squat right after using the Hypervibe for the first time. And
yeah, so that's the neural potentiation effect that I alluded to, where it wakes up the nervous system, and then you can go out and pump harder weights. And if you're pumping those harder weights, then you're going to build strength quicker. So whilst we'll use the machine just for the injured person or the weaker person, it can be used for the athlete to take their training to a higher level.
Right. And then also coming down after exercise, it helps to clear out the lactic acid from the system as well, so you can recover quicker, is my understanding as well.
Yes, in the middle frequencies, it does have that effect. Now, if I take it one step further, I can see the day when these machines are on the side of the field, so that athletes, prior to going onto the field, are just firing up their nervous system, ready for performance. And when they're coming off the field, they can be using it in those middle frequencies to be lowering, removing the byproducts of that excess exercise. It's a very exciting concept, and it will appear soon.
Yeah, wow, that's exciting. So I'm curious, back to the elderly patients, or working with some people either post-surgery or ones that have had muscle loss, or people that have just over time, as they become elderly, they've have muscle loss and they're not as mobile. They may be in pain.
Yes.
How do you typically start off a patient to avoid injuries, to make sure that they're actually, because there's sometimes curiosities like, well, can I get hurt on the machine? Or what's a good starting point or protocol to work with a patient and then help to move them up?
Yeah, sure. Look, we start gentle, of course. We will stand the patient next to the machine and turn the machine on and show them that the small amplitude of the plate, that it's not going to move them around. We'll then turn the machine off, stand them on the plate, and then we'll teach them the concept of where they're weight bearing through their feet. A lot of people with poor balance tend to weight bear through their heels, and that's going to have a very jarring effect on the machine. So we'll get them to rock backwards and forwards, get the feel of where the midpoint of their foot is, so that their weight is evenly splayed across their foot. We'll turn the machine on at very low frequency. Of course, we've got them holding on to the handles. And we'll spend some time in this, just talking to the person, saying, hey, what are you feeling? Do you feel comfortable? Do you feel safe? And then we'll stop the machine and ask them to get off. It's sort of like returning them to safety. Ask them to have a bit of wriggle around. How do you feel? You feel fine. And they're enthusiastic and then keen to step back onto the machine. Once we've got them back onto the machine, we'll increase the frequency to show them what it feels like. And then we'll start to get them to move by small squats, starting to move. We'll explain that here is the stop button if you're concerned. But also, you can just jump off or step off anytime you like. There's no problem. You don't have to wait for the machine to stop if you're feeling uncomfortable. Just step away. And so safety, confidence, comfort are all vital, important elements of making sure that they can use the machine well.
And what's a typical starting point in terms of number of minutes and that you would have a new patient come on? I'm sure it depends on their current state of health, but
Yes, yeah. Look, it's finding a balance between giving them sufficient quantity for them to think, yes, that was worth it, and not overworking them. So somewhere between the realm of 5 to 10 minutes in 1 minute increments is where we would start a person, but as you identified, depending, of course, on their starting place.
Right, exactly. Okay, that's great. So what other condition or uses have you had? What % of your patients would you see would typically get on the Hypervibe?
Percentage-wise, look, it's reflective of the kind of patients that you're seeing. So, being a musculoskeletal physiotherapist, backs, necks, shoulders, pain is their primary problem. I'm probably using it at about 30% of my clients. But for other physiotherapists in our practice who are working in the gym, they're using it on 80, 90% of their clients. And if I have a client who I think it's appropriate, I'll refer them up to my colleagues to use the machine on them. Another area that I wanted to touch on where we found it very useful is in the circulatory problems. So people with peripheral vascular disease, very cold feet, the nerves in the feet are being affected, so they lose their sensation. Diabetics also fit into that realm. And we'll often put them on the machine to create that capillary opening to increase the blood flow to the area. And these people are so excited to be able to feel their feet so well again. And we'll use this as a part of their warm-up to get the blood flow, to get the nerves moving well, and then we'll take them into their other part of their exercise program. And the delight that they share with us of being able to feel their feet so well again.
Yeah, wow. Yeah, that's amazing. So I'm curious, that brought up a question for me even. I had a microdissectomy at L5-S1. I had a 16 millimeter extrusion, and it took a while for me to recover from that because I had damage in my S1 nerve going down my left leg. And even my surgeon told me that I may never get full movement back in my left leg again. And, that was, really difficult for me to hear. And even like jumping rope and just basic movements, I wasn't able to lift my left foot off the ground. And today I have all of that back, and I use my my Hypervibe every day now. And I know it's been a catalyst, but I'm curious, what was it that helped me? How did it help with the nerve?
Yeah. Sure. Look, good choice of word there, Doug. It was a catalyst. It wasn't the cause of the cure. And I want to make it very clear. It's not a primary product for back pain. It doesn't solve back pain.
Right.
But what it does do is help many of the elements surrounding back pain to help you in your recovery. So I alluded on a few of them. Capillary opening, so increased blood flow. Neural potentiation, so stimulation of the nervous system. We talked about strength, and perhaps the last area is proprioception, which is positioning, knowing where you are in space. Now, if you have a back injury, all of those 4 elements are going to help you in your recovery process. Now, there is a natural resolution with back pain, we know that. This is just going to help it happen a little bit faster. What the Hypervibe did for you, likely, Doug, is that it started you moving. It's movement that is the key. It started giving you confidence that, yes, I can do these things and my back won't hurt. And then gradually you could progress the loading that the machine was creating, and your body adapted to that new load. It was also one of the great values too, is it also confused your brain a little bit as well, because you were getting all these sensory input and your brain was going, well, usually I feel pain. I don't understand why this is what's going on. And your confused brain then stopped focusing on your back, allowing you to move more, and you begin a sort of upward spiral of motion, decreased pain, normality. And then I'm sure you found that then gave you the confidence, the strength, the capacity to build your exercise in other domains as well.
Yeah, wow, that's great. It's definitely, I appreciate that. It has been a catalyst for sure. So another curiosity I have is, people that are elderly that haven't really worked out before, they haven't had a workout protocol or regimen that they've been on consistently for a number of years. How would you start someone like that off? And I'm thinking of my mom. I'm thinking of other people that I may know that may be in pain. They're just not used to exercising. And I do believe like that gentleman that you shared was able to put his pant legs on while standing up, and the dignity that can give him. And I know it can be a catalyst to help prolong and improve the quality of life for people. But what would be a good starting point in terms of just the way that you would get someone introduced to the platform?
Yeah. Listen, I'll take that back a few steps too, Doug, to help explain. This world we live on has a gravity force of 1G. And as a species, we've evolved upwards and we have systems in place to help us flourish in a world with 1G. As people become older, they lose muscle mass, their nervous system slows down a little bit, and their capacity to cope with 1G of gravity is almost exceeded. Now, the wonderful thing about the whole body vibration machine is you think of it as an artificial environment of increased gravity or increased G forces. So by simply standing on the machine with an increased gravitational force, you are exercising because your body has all the systems to cope with gravity, and by increasing the gravitational loading, you're building those systems, you're building that strength. So for the person you described, it really is as simple as just stand on the machine and turn it on. You need to do no more. Now, after a while, that can get a little boring for the person. They will look for challenges. So then you can start to begin those anti-gravitational exercises. So squats, calf raises. You could start to challenge them by putting them onto one leg to improve their balance as well. What we loved about the machine was the way in which we could try and use the person's function that they struggle with the most to practice on the machine. So in Australia and many other Commonwealth countries, there's a game called lawn bowls that's very attractive to older people. And it's like bowling, except it's a little more sedate, and you bowl along a grass to try and get as close as you can to a smaller ball, or the jack it's called. Anyway, so a lot of elderly people like to play bowls, but they have trouble getting down. We were able to replicate that position of squatting down in the lunge position on the plate, so they could practice their technique in this increased gravitational field and therefore build up their strength, improve their mobility, improve their balance, practicing the very function that they had difficulty with.
Wow, that makes complete sense. I mean, that makes me think of even people that, relatives that I've had and people that I've known that are passionate about golf, and they love that. And as they get older, they're just not able to have that same movement, or tennis, or other sports where they want to stay active, and their body starts to deteriorate over time. And this can be a great tool to be able to...
Yes, that reminds me, we have had golfers, so older people who are standing on the platform with it vibrating, will spin them around so that their back is to the control panel and there's open space in front of them. And then, we'll put a golf club in their hands and we'll have them practicing their swing on this unstable, moving environment. And it really challenges all their body systems to be able to maintain stability and control through movement on a vibrating platform.
Right.
As a physiotherapist, you can have a whole lot of fun with people finding ways to challenge what they take for granted.
Right. Yeah, that's amazing. So, you brought up gravity, and I love the fact that you brought that up. Now, there are some, either companies or people that have a perception that high levels of exposure to gravity can actually be very harmful to our health. And, I've read studies that suggest that even walking, you're exposed to about 10 Gs when you're putting your heel to the ground. So I want to help, if you have any knowledge about this, just to help put people's minds at ease, because again, some of these other companies that are super low gravity and they don't have the ability to go to the higher levels would say, well, you don't want to go beyond 1 or 2 or 3 Gs because it's dangerous.
Yeah, look, I can't see where that danger is coming from. Think of the chain of the human body. Our ankle joint, our knee joint, our hip joint, our spine, they all absorb the forces that we apply when we're walking, when we're running, when we're jumping. They absorb the forces through the muscles on either side of the joint. So the more we can challenge those muscles, the stronger they will become. in everyday life, that's what happens. We walk, we run, we jump, but as we get older, our enthusiasm for those activities diminishes, but then so too does our muscle mass. Whole body vibration provides that opportunity for exposure to gravitational forces that we wouldn't be getting otherwise. I have a vision. I see whole body vibrations in nursing homes, and I see elderly people being taken for their dose of gravity. Today, Jim, we're going to go and spend 10 minutes and we're going to give you 15 Gs of gravity. And that's equivalent to, I'm going to make this figure up, so forgive me, walking for an hour. But Jim's able to achieve that in 10 minutes and in the safety of his environment, being supervised, holding on to a platform. So the risk of falls is diminished.
Yeah, that's great. I appreciate you sharing that. It's been such a tremendous thing that I've just seen for so many different people. So
yeah, look, bed rest is, we all know that prolonged bed rest is bad for us, and it's assumed that what's wrong with bed rest is we're just not using our muscles enough. It's more than that. Bed rest lays us horizontal, and so our body is now acting across gravity. And that's what's bad. It's the absence of gravity in bed rest that is bad for us, not so much the absence of movement. As I said before, we are designed perfectly to flourish in an environment with gravity, and for us to continue to grow, we need to expose ourselves to gravity. Life is a challenge, and we have to embrace that challenge to flourish.
No, that's great. And one of the things you said earlier, which resonates for me, because I actually had one of our clients say this, is that you just have to really show up and stand on the machine, because it kind of does the work for you. Now, you may be motivated to also participate in the exercise, but for so many people, to change habits and understanding just how neural pathways are created in our brain and how unconscious patterns of behavior, whether it's poor diet, lack of exercise, for so many people that are not accustomed to exercising, it's a significant shift to ask them to drive to the gym, go work out, lift weights, run on a treadmill, do extensive exercise for a long period of time, shower, come home, and it's a disruption in their day. Whereas if someone had a Hypervibe either at their home or their clinic that they would go to with their medical professional, that literally you just show up and you stand on it for a couple minutes. And in that amount of time, your body gets the equivalent of being exposed to 20 or 30 minutes of exercise.
Yeah, look, you're exactly right. It's that middle step, isn't it, between sedentariness and full activity. And some people who just need that little push, that little bit of help, this is going to help get them there.
Yeah. And then the other thing that we're seeing a lot of great results with, and again, understanding that we weren't designed as a species to be sitting so many hours per day in our work environments, that
yes.
When I got us into the Google headquarters and flew up there, I mean, even their employees, they have an amazing exercise facility, and the vast majority of them never use it. And because we're so conditioned with our behavior, but I know even working from home, how lethargic you feel from sitting down behind a computer for multiple hours in a day. And for corporate wellness, and one of the things I'm super passionate about is getting more Hypervibes into professional work environments where employees, and even a woman wearing a dress and heels, can walk over to the machine, kick her heels off after a few hours of working, stand on the machine for a couple minutes, activate her entire system, their endorphins activated, get the blood circulating, go back to work and actually be more productive. And if there were studies around this, I would suggest that there would be a quantifiable ROI off of the investment that a business would have to invest in having a Hypervibe in their work environment for their employees because of those very things. Just to be sharper and more mentally aware when they're at work.
Yep, I look 100% with you, Doug, and I'll add one more benefit to that. It warms up your feet. So in winter, if you're working away, you're sitting still, your blood circulation slows down, your feet get really cold, it's uncomfortable. So I'll often duck up to our gym, stand on the machine for 5 minutes just to warm up my toes.
Yeah, wow, that's great. I really appreciate it, your time and your investment of time today and your willingness to share about Hypervibe. Is there anything else, I want to honor your time and not take up too much more of it, but is there anything else you want to share in terms of just perspectives or feedback that you have for other medical professionals that will be watching this, or even potential customers as well?
Oh, look, it's the greatest thing since sliced bread. We have been using it, as I said, for 14 years in our practice. And you don't use a piece of equipment unless it's producing great results for that long. So I would encourage people to take a look at it, to try it out, and to research the effects of it. We've loved our machines. We've loved our relationship with Hypervibe. Always willing to help us, and I couldn't encourage people to more to take advantage of what this machine offers.
Oh, that's good. Greatly appreciate that. And just real briefly, what else are you up to in the world? I understand you've got, your practice is still actually going, and then you have the .physio domain. You just want to share a little bit about what that is and how you're engaging with that and what your passions are and why you did it.
Sure, thanks, Doug. Look, another one of my visions, very visionary, is to unite the physiotherapy and physical therapy profession around the globe, particularly in the digital space. And so I've joined a number of others to create a new domain extension for the profession. So instead of .com, .org, .net, or the various country codes, physiotherapists and physical therapists can now have a domain extension that ends in .physio. It's one of 1,400. So there's a .doctor, a .dentist, a .lawyer, a .accountant. About 500 multinational companies have their names. So you'll soon see websites ending in .google, .apple, Netflix, the NBL, the NFL, various other codes all have their domain extensions as well. And so what we're seeing is a change in the way that we navigate through the internet. And I'm really excited to be able to offer a version, our own namespace for the physiotherapy and physical therapy profession. And so if you are one of those, can I say it's worth taking a look? Just simply go to www.dot.physio and search to see if your domain name is available. Thanks, Doug.
Absolutely, I appreciate it. We'll have that in the information right below the screen too, so people can just visit your domain and learn a little bit more about you. And then also we'll make sure that we link your practice as well.
Yeah, great. Look, I'd also like to any professionals out there in the globe, if you want to know more about whole body vibration and want to reach out, love to make myself available, share our experience.
Really appreciate that. And we'll make sure we add your contact information below as well. And that's one of the things we're very honored by is people such as yourself that are out there in the field that have been using Hypervibe for a number of years that are so passionate, so willing to be able to share your personal experiences just because of how it's been so impactful, not just for your practice, but also with your clients and patients alike. And we're just honored to have people such as yourself within our community and hope that we can earn that right for anyone who's watching this as well, so we can contribute to improving the quality of people's lives around the world. So with that,
agreed.
Really appreciate your investment of time and thank you again so much for investing this time. And if you have any questions and we can do anything for you, feel free to contact Glenn or ourselves at Hypervibe, and we look forward to being of service to you. Thank you very much.
Thank you.